welcome back. I'm Dr. Jones, a board-certified OBGYN, and today we're talking about a topic that is hard to talk about but so important. Miscarriage is something I often hear my own patients say is too quiet, and sometimes even you guys are telling me that your doctors and your advanced practice providers aren't giving you enough information about. Later in the video, I also had the super great honor of getting to talk to Ciara Schultzzie, a fellow YouTuber who makes body positivity content that I absolutely love and who experienced a miscarriage earlier this year and talked openly about it on her channel. I can't wait to answer some of her questions and some of yours in this video. If you're new here, I post information on pregnancy, gynecology, and a little bit of parenting. If you're interested in that, hit that subscribe button. We are so close to 500,000, which, what? I don't even know what to say. If you're not subscribed and you want to be, I would love for you to help us hit that milestone. What is miscarriage? Miscarriage is any pregnancy loss that happens prior to 20 weeks. After 20 weeks, we generally refer to this as fetal death or stillbirth or preterm delivery. Less than 20 weeks, there's a variety of types of miscarriage. Now, you might see this sometimes designated as spontaneous abortion. Why? Abortion is a word that in medicine means pregnancy loss. It doesn't mean elective termination. Politics has hijacked this word from us. Spontaneous abortion is the same thing as miscarriage. Spontaneous miscarriage is one that just happens. You usually would start having bleeding and cramping and past tissue, and that would be the miscarriage. There's also a miscarriage called missed miscarriage. This is where a patient who has a pregnancy that otherwise seems normal goes in for an ultrasound and we find out that the fetus no longer has a heartbeat. Anembryonic would be a miscarriage where there's just a sac and no fetal pole. Sometimes you might hear your friends refer to this as blighted ovum. The question that you guys had when I asked about this on Instagram and on the community tab on YouTube was, does a chemical pregnancy loss or a chemical miscarriage count as a miscarriage? Chemical pregnancy is essentially where someone is right around the time or just before their period would be due, takes a pregnancy test, and then very soon thereafter, hours or days, has bleeding. It's kind of like a heavy period, and then the pregnancy test is negative. Yes, this counts as a miscarriage. It's a very early pregnancy loss. The hormone, HCG, that makes a pregnancy test positive is present in the urine, but the pregnancy doesn't get far enough along to actually identify it clinically. And then we have late miscarriage. The definition of late miscarriage will vary depending where you look, but most people consider anything over about 12 weeks and up to 20 weeks to be a late miscarriage. This does not include full-term stillbirth because, like we discussed earlier, after 20 weeks, we don't medically refer to pregnancy loss as miscarriage anymore. The next thing I want to cover is risks, because this seems to be one of the most common things people want to talk about is, what is my risk of miscarriage? So if you just take every pregnancy that ever happens and say, what is the chance that the pregnancy will end in miscarriage? That number is up to 30%. Most of those are so early, they are either undetectable or they go unnoticed. Part of the reason miscarriage seems so much more common now than it did maybe 2 or 3 decades ago is because of what we discussed earlier, which is really good early testing that is available very easily. Urine test, like a pregnancy test that you buy at Walgreens, is just as sensitive as a urine pregnancy test that I would do in my office. When we separate this out into clinically recognized pregnancy, meaning someone has a positive pregnancy test, they come into my office and we do an ultrasound, that would decrease the risk of miscarriage down to about 1 in 10 or 10%. You can see that a lot of these miscarriages in that 1 in 3 or 1 in 4 number are happening well before 6 weeks. And after a heartbeat is identified, that number drops even further. I don't say that to minimize the loss that happens before a pregnancy is clinically recognizable, because a lot of people really grieve those pregnancies still, and that is totally okay. It's also okay if you didn't feel that grief and it was just something that happened to you. I say that because a lot of people spend many weeks or even their entire pregnancy very anxious about pregnancy loss, and I think it's important to know that your risk decreases drastically every week that goes by of the first trimester. Once you get into the second trimester, so after 12 weeks, the risk of miscarriage has dropped to below 1%. There were lots of questions about, is this genetic? And the answer to that is usually not in the way that people are thinking when they ask that, which is, my mom had a miscarriage, does that mean I will have a miscarriage? There are some conditions which can be genetic, which increase one's chance of having a miscarriage, but most miscarriages are not the result of those genetic conditions. Okay, if it's not genetics, then what are the risk factors? The strongest risk here is definitely going to be age. Someone who is between 20 and 30 has about a 10% chance, but once we get up to over 45, that number goes up to over 60%. And this is likely due to chromosomal abnormalities from the age of the oocytes or eggs. The middle range there, I would say, is gradually increasing from about 30 to 45. I hate quoting exact numbers, and I know I've been doing that a lot in this video already, but I feel like that makes people really focus on how often bad outcomes happen, and this is hardly ever, almost never, something that you can control. Because of that, I think the best way to look at it and the best way to answer what is your risk is to say that the vast majority of people, with the exception of someone over the age of 45, will have a much higher chance of having a normal, healthy pregnancy than they will of having a miscarriage. Try not to let it overwhelm you if you are actually pregnant or if you are intending to become pregnant at some point in the future. We covered age. Now let's talk about race. People of color are statistically and consistently found to be far more likely to experience miscarriage, particularly between the 10 and 20 week time frame. The most likely explanation from this is likely cumulative stressors from social determinants of health, occupational, and environmental exposures that people of color have at higher rates than people who are white. Those chronic stressors are super important, and I talked a little bit about all of that in my racism in medicine video if you're interested in a little bit more in-depth look at why these racial disparities are present. As always, I can link the information about this in the description box. Does stress cause miscarriage? If someone has an overall stable life and environment and they have an acute period of stress during their pregnancy, something bad happens to you, but otherwise your environment is stable and that's something that you can, navigate through and get through with the help of your social system, that is unlikely to cause a miscarriage or be related to a miscarriage. However, if someone has a significant period, even prior to pregnancy, of chronic stress from social disparities, racial disparities, food insecurity, risk of violence, any of these things that cause chronic long-term stress from environmental or life instability, these things are certainly associated with an increased risk of miscarriage. I would say the most common question I get is, it happened once, is it going to happen again? And the short answer is probably not. Most people who have a miscarriage go on in their next pregnancy to not experience that again. After one miscarriage, there is a very tiny increase in your risk in the next pregnancy. It's still far more likely that you will not have a pregnancy loss the next time you're pregnant. If you've had 2 in a row, that risk increases a little bit more. But even after 2 in a row or 3 in a row and even 4 in a row, it is still much more likely that the next pregnancy will not be a miscarriage. Okay, now I want to answer a few questions that Sierra had.
Hi, my name is Sierra Schultzzie. I make videos here on YouTube about body positivity and fashion, and I also recently suffered a miscarriage, and I've been talking a lot about my journey with fertility and trying to conceive. And Mama Dr. Jones, your videos have just meant so much to me, and they've helped me to understand my body and my health so much, and I think what you're doing is so important and so needed, so thank you for that.
Thank you for so openly sharing about your infertility journey and about your pregnancy loss, because you're making a difference and it's important.
The first thing about my miscarriage that really shocked me was the physical pain. I expected the emotional pain to be difficult. The pain really hit me like a brick wall, and I did not expect it. So I guess I would just be interested in hearing more about the physical aspects of having a miscarriage and recovering from that.
I think this is something that a lot of people are largely unprepared for. The pain associated with miscarriage can be very, very significant. What's causing the pain is the contractions of the uterus, and that is very similar to labor contractions, and the dilation of the cervix. For some people that happens really quickly and the pain doesn't go on for a long period of time, and for others it can be very prolonged. I often will offer someone pain medications when I send them home from my clinic. Don't send them with like 50 Norco or anything like that, but enough that they can take some prescription dosed ibuprofen as well as a couple of stronger medications if they need to try to avoid having to go to the emergency room for pain control. I don't think there's an easy answer to this. That's why I'm rambling on, but the answer is yes, it can be extremely painful. Not to mention the fact that when you're dealing with confusing and difficult emotions, pain is even more so exacerbated. When all of your headspace is going to processing, it makes physical pain that much worse.
Is it true that you're more fertile after miscarrying? I've heard a lot of people say this online. I'm now 3 months out after my miscarriage, and is the clock ticking, or do I have just as much of a chance getting pregnant a year from now as I do right now?
I think the reason that people say this is because oftentimes someone will have a miscarriage and get pregnant before they even have another cycle after that. And that kind of gets perpetuated into this increased fertility. Your fertility is probably the same after a miscarriage as it was before. If you go back to having regular cycles, you shouldn't have an increased or decreased risk unless some other risk factor changes as to the likelihood that you will get pregnant again.
After having my first miscarriage, I feel like most of what I heard was just, you know, try again. It's probably just a one-time fluke thing. But is there any testing that you recommend women look into after they suffer their first miscarriage?
After one miscarriage, generally we wouldn't recommend extensive workup. The old recommendations were that after 3 in a row, someone would pursue investigation into recurrent pregnancy loss. The general consensus now is that after 2 in a row, that probably makes sense. Although I will say it's pretty rare that I find an exact cause with that blood work. So after 2 miscarriages, I will usually set patients down and talk them through what options we have, what we should look at, and the chances that that will actually identify a problem. And some people want all the testing right away. Some people would rather try again. After one, I think the stress to the patient and the cost doesn't make sense.
So when I got pregnant for the first time, I was doing a lot of research into every little thing I could do to minimize my risk of miscarriage. And now that I've had a miscarriage, my question is there anything specific that I should be doing to try and minimize the risk of a second miscarriage?
That's such a common question that I get in my clinic. I don't ever know exactly how to answer it because I know we just want to have control. The real answer to this is we have almost no control over this. What I want you to take away from that is that you didn't cause your miscarriage and it's not something you need to work on. This world is full of terrible, unlucky things. And unfortunately, miscarriage can be one of those. You didn't lift something too heavy or bend the wrong way or let your toddler roll on top of you or run too much or hike too much or eat the wrong foods. Those things did not make this happen. I know it can be scary going forward and trying again, and certainly trying again and having another pregnancy that goes on to have a take-home baby is not expected to erase the pain of your miscarriage, but you don't have to fix anything because you're not broken and you didn't make this happen.
Okay, this question's kind of a downer, so you can cut it if you want, but it's one that's been on my mind a lot, and that is, at what point should I give up trying to become pregnant? If I have a second miscarriage, a third, a 10th, I've seen stories of women who've had like 15 miscarriages and then they get their rainbow baby. But at what point do doctors recommend you look into other options for parenthood other than trying to conceive naturally?
This is such a good question. Honestly, I don't think I would ever even consider cutting this question because it's so important. The general answer to that is when you want to. When you feel like the prospect of another loss is too much for you, it's okay to stop trying. I think it's really important for people to hear that because the number is going to be very different for everyone. I will say, as an aside to that, it's uncommon to get to that number of losses without successfully carrying a baby. But it is totally reasonable to stop trying because pregnancy loss is affecting you and it's hard. I think that's an individual decision. Talk to your doctor and get their opinion on it, but my personal opinion is that typically it's going to be an emotional stopping point before it's a medically necessary stopping point.
All right, those were my main questions that have been on my mind since my miscarriage. Thank you so much for including me in this video and just for everything that you do on YouTube. It's so needed and I love watching everything you do. So thank you.
Thank you so much, Sierra. I feel the same about you and I can't wait to see your good news announcement because I know it is going to happen. If you have any questions, leave them in the comments down below and come back next week when I talk about things that social media taught me that medical school never could have. Be kind to yourself, to each other, to me. In the comments, be kind, and I will see you next time.